So today I am going to talk on whether accuracy of robotics is established in orthoplasty or not. So there are some limitations to the conventional TKR, like subjective gap assessment. The gap assessment is done usually at 0 and 90 degree of flexion, leaving a chance for the mid-flexion instability. There are bone resection level through saw blade are variable depending on the quality of bone. There is no real-time intraoperative feedback to the surgeon, and there exists many intra and intra-observer variations. According to one study, they have found that the estimation of transepicondylar axis, right sides line, and posterior condylar axis is accurate only among the 65 to 80% of the surgery. All these factors lead to the poor reproducibility of the TKR results in conventional TKA. Also, there exists 18 to 20% of the dissatisfaction rate in conventional TKA patients. This is mostly attributed to the either malalignment or the poor soft tissue balancing, and most of these attributes are either avoidable or controllable. That's why there is need for more accurate aiding tool during the surgery. So, according to one study, during the intramedullary zig placement, the error up to 8 degree can occur in the restoration of the mechanical axis. Also, there exists a femoral bowing in the coronal plane, which makes the long intramedullary zig placement more difficult, and the incidence of femoral bowing in Asian population more, especially in the females. There also exists a discrepancy between the planned resection angle and the radiological angles in coronal plane and the femur and tibia using conventional zig-based methods. So in robotic arthroplasty, robot is not just a planning tool, it is actually execution tool. So it offers the advantage of improved accuracy and precision. The operative plan can be executed with sub-millimeter accuracy. It is reproducible. That accuracy allows surgeon to replicate exactly what they have planned, and which simply wasn't as accurately achievable when using naked eye. So coming to the accuracy and precision, accuracy is the measure of the how actually your results are close to its true value or its original value, and the precision means the how your test values are close to each other. So accuracy is truthful to its intention, and precision is truthful to itself. So with low precision and accuracy, there are poor clinical results in survivorship, mostly in the conventional TKs. As the precision and accuracy increases, this leads to the improved function and satisfaction, promising the longer implant survivorship. So accuracy in robotics is mainly because of there is patient-specific and anatomical data registration, either using pre-op CT or MRI scan or intra-op bone morphing. The software recommends the bone resection cuts. There is real-time validation of each and every cut, and intra-op real-time feedback for optimal implant positioning and soft tissue balancing throughout the range of motion. So accurate implant positioning in robotic is also possible because of there are patient-specific resection angle compared to the fixed resection angle in the conventional TK. There is accurate gap balancing, and there is sub-millimeter accuracy of the bone cuts, either using robotic mills or saws. Also, after the cuts with irrigation, the bone temperature remains 44 to 47 degrees. It leads to less bone injury and better implant fixation. So in a study evaluating the accuracy of RoboDoc system in the restoration of joint line and mechanical axis, they have found that the conventional TK, the mechanical axis deviation greater than 3 degree in the 19% of the patient, joint line outliers were approximately 20%, and notching in 10% of the patient. Compared in robotic TK, they have found that all these parameters are almost nil. Our institute has also performed 3 studies on the Navy robotics, and in studies they have achieved mean value deviation of following parameters within significantly good level. So precision and accuracy in all planes with maximum RMSE of 0.56 degree. So also the MECOS is the study evaluating the mechanical alignment and accuracy of component positioning. They have also found a significant better result in the robotic group. Systemic analysis reviews of the literature, they have also proven the improved accuracy in implant positioning and the radiological parameters. So, while comparing the robotic system, the author has stated that there are no objective measures for the accuracy of the different systems currently available, but they have stated one star-based ranking depending on the what features are available with that particular system. So, they have given 3-star, 2-star, and 1-star rating depending on whether robotic arm-mounted cutting tool is available or whether it is handheld, and their haptic feedback and virtual boundary. So, depending on that, Meko and Wellis, according to the author, they scored 3-star. Corey achieves the 2-star rating. These are the outliers compare of variable robotic system. The unicondylar knee orthoplasty is accurate implant placement is the key factor, and being minimally invasive, it is technically more demanding. The Australian Joint Registry have showed that the revision rate was almost half for robotic partial knee replacement at the end of 3 years. The similar graph showing the survival advantage of robotically performed partial knee replacement. And the one study compares the unicondylar knee replacements of the Mako versus Nevio. They have stated that there is no difference in radiological alignment of the implants in clinical outcomes at the end of 1 year. Coming to the robotic hip replacements, the studies have found the cup placement within the Leeuwenhoek-Kalman safe zone is significantly higher in the robotic assisted THA. Also, the stem alignment outliers were lower on the robotic group.
Sharad, you're out of time. If you could wrap up your talk, please.
I am about to finish. Similar study. So to conclude, the robotic surgical robots are for orthoplasty might be in their infancy when considering their actual potential, but they have already demonstrated the clear benefits in achieving accuracy and precision. Thank you.